first of all, I'm very happy and pleased to have with us today Miss Hailey Royston. She has her master's in nursing. She's also certified medical surgical registered nurse, and she is a nurse outcomes educator. She covers the PCU, virtual hospital, flex pool, and interventional radiology. So welcome, Hailey. Tell us a little bit about
Thank you, Diane.
And why you do it.
All right. So as a nurse educator, here at Sinai, we are hospital-wide educators. So we don't just focus on specific units. We do focus on units like the ones that Diane just mentioned, but we also do all hospital-wide projects. So that means any employee coming to the hospital, that's a clinical employee, we do their onboarding orientation. We call it clinical orientation. We also do hospital-wide competency, and then we focus on really anything impacting our nurses. For example, if we're getting a new IV pump, of course, it will impact my units that I cover, but it will also impact the entire hospital. So in my role, I also take on hospital-wide projects that would impact every area of the hospital. A big part of my job is supporting new graduate nurses. So when we get a new graduate nurse or a new specialty nurse, I support them throughout their entire orientation. Each unit does have a little bit of a different orientation. Something like ICU would be several months long, whereas somewhere like a telemetry unit may be closer to 12, 14 weeks. But we support them each week. We meet weekly and just support them throughout their journey here to help them be successful. So that's a big part of what I do, and I really, really love it.
You are awesome. I got a chance to, I was privileged to work with this woman at Sinai Hospital during her mentoring me for the educational piece for my master's with specialty area in education. And she is just awesome. Everyone loves her. She has a great personality, a great aura about her. And she's going to help a lot of people go far in this hospital, and a lot of nurses soar in their field. I was just honored and privileged to have worked with this woman. Thank you so much, Hailey, for joining us. And before you leave, I know you're really busy. This woman take time out of her busy schedule today to be with me. So this is awesome. What words of advice can you give two different things. What words of advice can you give a new student that's going into nursing for their first year? And what words of advice can you give to a nurse that's transitioning from a bachelor's degree to a master's degree and thinking about education in a hospital setting?
Okay, so if you are a nursing student, so like a new time nursing student in a bachelor's program, was that the question, Diane?
Mm-hmm.
Okay, my advice for you. So my BSN program, that was tough. Nursing school is so incredibly hard. I don't think anyone will ever disagree with that.
Oh my God,
me, that was really a good time. For me, that was really a good time to establish your organization. Being organized in nursing school, you just have to do it. That's how you're going to get by. So establish how you're organized, whether it's an agenda book, whether it's a calendar, appointment reminders on your phone, whatever it is, figure it out and really nail that down. That's how you're going to be successful in nursing school. There's just so many project deadlines and clinicals and exams. And that's really, really the time to do it. And that's only going to help you throughout your career. I'll be honest, before I went to nursing school, I was not organized at all. It's just not how I was. My bachelor's program totally changed me. And that's something I brought with me into my career as a bedside nurse and as a nurse educator. So that's definitely my piece of advice. For a student going into their master's program, you asked what was my advice for a BSN to MSN transition?
Correct, especially if they're not looking into working in a university for teaching, but mainly teaching in a hospital setting like you do right now.
Okay, awesome. So getting your foot in the door with education is really difficult. As you guys know, when you're looking for jobs, a lot of them say that they want you to have experience. So if you're like a bedside nurse or, let's say you're employed on a unit right now as a bedside nurse, the time to start getting experience with education is then. When you apply to your first job as an educator, if you're interested in going that route, it's really, really helpful to be able to explain some of the experience you've had with education. So like unit-based initiatives, that's the time to do it. When your managers are coming around and asking If you'd like to be a super user for something, or if you'd like to help with trainings on the unit, say yes. Get involved in that. Start precepting other nurses on the unit, other techs on the unit. That's only going to help you. That way, when you do decide to transition into education and they ask you, tell me about your experience with education, you have something you can talk about, and you can talk about some of your deliverables. How were your projects successful? If you did something on CAUTI, what did you do? How did you do it? How did it impact the unit? And that's what your employer will want to know. Your first job as an educator is just tough to get because you don't have a whole lot of experience in education yet. So that's really, really important. Make sure you take all of those opportunities that your managers give you.
Awesome. Thank you so much, Hailey. We really appreciate you being with us today.
Of course.
Thank you for taking time out of your very super busy schedule. Okay.
Thank
so
you,
thank
Diane.
you so much. Have a wonderful, wonderful day. And thanks again.
You too. Thanks, Diane. Bye. Take care.
Bye-bye. So I hope you guys got a lot out of that today. Like again, I said, Hailey, got her bachelor's degree first at Stevenson University, and then went back and got, I'm sorry, I apologize there. It's her Salisbury University is where she got her bachelor's of science, and she had her master's at Stevenson University. And again, as she was saying, you really need to get your feet wet in terms of education. I know I've been a nurse for over 20 years, and the whole time I was nursing, after my first year, I literally was cross-training people. Next thing you know, I'm running charge. And while you're charge nurse, you also have to help train and teach people who are transitioning to your unit or your floor. They could be a emergency room nurse. And I think at the first time when I first started nursing, I was in PCU, Progressive Care Unit, which is like pretty much 2 step down from the ICU. So you have intensive care unit, you have the intermediate care, which is IMC, and then PCU, which is a progressive care unit. Either way, all 3 of those units, the patients are on can't even say it, telemetry monitors. We're watching their heart rhythms and what's going on there with that. And they stay on the monitor the whole time they're there based on the type of medications and drips and things that we're hanging and giving them. And we have to keep a close watch on those patients. So let's say, for example, I had a patient nurse that was in the ER and she's transitioning to my unit. There's still training involved. You're already a nurse, but you may not be trained specifically to what we need on that particular unit, or vice versa. When I was in the ER and I had nurses coming in from the floor, which is the ICU, the PCU, med surg, etc. Same thing. They're not geared to switch back and forth from pediatrics to psych to critical care to OBGYN. So you have different areas. You kind of have to cover everything in the ER because you don't know what type of person and what kind of ailment they're going to have when they walk in. So you kind of have to be up to par on everything. So yeah, teaching is all the time. So I hope you enjoyed today's information, and I really just want to shed light on that. So I mean, we all know, the current nursing students know, nurses who are current nurses right now, we know school was no joke. Oh my God. That's all I'm going to say to that. But the great thing is to have people like myself and others to help guide your way, hold your hand, and be there for you like people were not necessarily there for us. And that would have made a huge difference in my life to have a mentor starting from the school level into the career. Because you don't know what you don't know. And you can't ask questions about things that you don't even know exist, or issues you don't know that exist. And you find these things out, unfortunately, on the job and as things goes along, like you do with a lot of things in life. But it's great to have someone hold your hand. So again, I'm so happy we had Hailey. And if anyone's thinking about doing education nursing, obviously you have to have some kind of foundation yourself. You have to have some kind of knowledge base. That knowledge comes from not just books, but actually living that life as a nurse, taking care of your patients, learning from your interdisciplinary team, such as your respiratory therapist, your case manager, your doctors of different specialty areas, other nurses and other nurses in different units and different areas of nursing. So many areas. That'll be a whole nother video. But thank you for joining me today. And don't forget to like, subscribe, and click the notification button for more information about nursing and learning about nursing and seeing if this really is the field for you, because this is it can be tough and challenging, but it depends on what your why is. Why do I want to even be a nurse? Do I care about people that much that I'm willing to bust my butt and study my butt off and not get sleep for days and not necessarily always feel like you're getting paid what your value is, because you never will. Not in nursing. Nursing, you have to get kind of like a feel for it in terms of your payment is also the joy that you get when you help others. Your payment is also that hug or that touch or those words from that patient or that patient's family that's saying, thank you so much for being there for my mom, for my dad, for my uncle, for my sister. Oh my God, you saved their life. If you weren't there, this, that, and the other could have happened. Thank you so much for being there for them. Thank you for genuinely caring. That's what a lot of nursing really is. It's really not a lot about the money, believe it or not. Yeah, that's it for today. You guys have a wonderful day, and thank you again for joining us on Skill Snacks. Take care.